Discussion on vaccines, Healthy People 2020 seeks to stress the importance of such immunizations, especially in children and infants. With new emerging immunizations and circulating rumors on the internet and in the media, many may wonder if they are of greater benefit than harm. We can rest assured, though, that immunization recommendations are published after extensive research. A group of 15 experts in the field of immunization selected by the U.S. Department of Health and Human Services, known as the Advisory Committee on Immunization Practices, or the ACIP, is responsible for viewing and reviewing immunization standards. Others may question the safety of recommended immunizations, especially the ones developed in the last few centuries, like the influenza vaccine or the meningococcal conjugate vaccine. Significant information has come out, though, denying significant links between immunization-related reactions or disease. The Mayo Clinic performed a long-term study on autism in 2005, the first of its kind, in a Minnesota town, and found the rise in autism diagnoses was connected to the broadened, more precise criteria for autism established in 1987, as well as the improved awareness about autism and diagnosis. In addition, according to the U.S. National Library of Medicine, research has led the American Academy of Pediatrics and the Institute of Medicine to agree no vaccine or part of any vaccine is responsible for the number of children currently being diagnosed with autism. Ultimately, the benefits have outweighed the risk in findings, and it's important to think about the risks of not having these vaccinations. Several updates to the immunization recommendations, as found on the 2010 Morbidity and Mortality Weekly Report, have been made, including a greater push for influenza vaccinations ever since the 2009 Influenza A H1N1 pandemic. Specifically, Healthy People 2020 is advocating child immunizations and making sure people are aware of and encouraged to take their children to receive 11 certain vaccinations before the age of 2. These vaccines include the hepatitis B vaccine, also known as the Hep B, the rotavirus vaccines, RV, diphtheria and tetanus toxoids and acellular pertussis vaccine, or the DTaP, Haemophilus influenza type B conjugate vaccine, HIV, pneumonia vaccines, also known as pneumococcal vaccines, inactivated poliovirus vaccine, or IPV, influenza vaccines, measles, mumps, and rubella vaccine, or MMR, varicella vaccine, also known as VAR, hepatitis A, Hep A vaccine, and finally, the meningococcal conjugate vaccines, quadrivalent MCV4. This may seem overwhelming, as immunization schedules can be to most parents and those in the public, but information is readily available to the public, and it can be found on www.cdc.gov/vaccine. On this site, documents can be found for keeping records of vaccines taken for school systems if paperwork is not provided, charts of when immunizations should take place, and even a tool that can be used to enter a child's date of birth that generates exact recommended dates of when immunizations should be made for the child. Overall, Healthy People 2020's goal of decreasing preventable infectious diseases via immunization is an achievable and a practical one. If we all band together, we can foster a healthier next generation. We can help to protect our loved ones, children, and selves from unnecessary illness. Thank you.